Here today with Jim Teed of Highmark. Stay with us.
Thanks for joining this week's Go Erie Live discussion. Today, Erie Times-News reporter Jim Martin and Jim Teed, Vice President of Regional Markets for Highmark, will be talking about a lot of changes in the healthcare landscape this week for the Erie region. I'm Christopher Millette, and I will be moderating your Go Erie Live comments today. Thanks to Gannon University for sponsoring these live discussions every week. Enjoy the conversation.
Good morning, rather. Obviously, a really big week in Western Pennsylvania healthcare this week. We had the announcement Monday that UPMC, which includes UPMC Hammett, and that Highmark, which includes St. Vincent here in Erie, had come to terms on a 10-year agreement, which, among other things, essentially continues the terms of a 10-year consent decree. It does it under other terms that continues in-network rates for a lot of people, and very exciting time for a lot of people. It allows people to continue to receive care. I think there's also some confusion for some people who assume this means that everyone can get care at both facilities. Mm-hmm. Jim, can you kind of address some of the confusion? Who can get care, who can't, and
Sure.
maybe straighten out some of the confusion for us?
Absolutely. As you said, it's a very exciting time for Western Pennsylvania and for us here in Erie. This isn't an extension of the consent decree. This is actually a brand new contract. It's a 10-year contract with UPMC. And what this contract allows is, if you are a Highmark member, you will have in-network access to the UPMC facilities. At Highmark and at other insurance plans, we offer different products. So not every product that you have, if you have a Highmark card, you're going to have in-network access. What is going to happen starting on Monday, on July 1st, there are going to be two products. One is the PPO product, and that, if you have that product, then you are going to have in-network access to all UPMC facilities. The other product, which is a lower cost product, is our Community Blue product. And with that product, you will be out of network for UPMC. And what this Community Blue product does is it drives those members to the lower cost Allegheny Health Network facilities. So the higher cost UPMC facilities like UPMC Hammett, UPMC Presbyterian down in Pittsburgh, they will be out of network.
Now, just to be clear, that's nothing new in a sense. That's the way things would have been prior to this agreement. Am I correct about that?
Absolutely, yes. Yes.
Okay. What about doctors themselves? What if people have switched doctors? Mm-hmm. Are you hearing a lot of concern, a lot of confusion about on that front?
Really, I wouldn't say confusion or concern. Some members who have changed from their UPMC physician, if they have that PPO Highmark card, they will be able to go back to their UPMC physician should they wish. Over the past year, we've really been working. We were expecting the consent decree to end on June 30th, and so we had a transition team here in Erie that assisted patients that had that Highmark card that were utilizing a UPMC facility, UPMC private practitioner or PCP, and we assisted them in getting into the Allegheny Health Network and finding a PCP or a specialist at Allegheny Health Network or an independent facility such as LECOM or Meadville Medical Center. So what I've been hearing this week is some of those members, I talked to 4 members yesterday that had made the switch from UPMC to St. Vincent, and they have absolutely no plans of moving back to UPMC. The experience that they've had over the last several months at St. Vincent has been extremely positive, and they plan on staying at St. Vincent. They expressed to me the ease of care at St. Vincent, with the new opening of the East Side Pavilion, the West Side Pavilion, just being that much closer to their homes, they're going to stay.
Sure. And in fairness, there's probably some stories like that with both
Absolutely.
healthcare providers. Let's say they do want to switch back, though. Is that going to be a big deal? Is that going to be something that they have to wait for an open enrollment period? Is that something that they can just do relatively seamlessly?
Well, if they have the Highmark PPO card,
Correct.
they can pick up the phone and call their provider, their old provider, whether it be a St. Vincent provider or a UPMC provider. They can pick up the phone, call, and schedule an appointment.
Okay. Now, a lot of this we're talking about revolves around things kind of going back to the way they were. Am I correct?
Yes.
Are all these things, is there any aspect of what we're talking about that's different than that? So everything we've talked about so far is just sort of, this agreement involves kind of turning the clock back to how things were. Am I correct?
Yes. Yeah.
Are there other aspects of the whole agreement, though, that change things? That in terms of like access to Hillman, things like that?
With your PPO Highmark card, you will still have access to Hillman. And if you have the Community Blue product with Highmark, you will not have access to Hillman. But this is really no change from how it was 6 months ago until moving forward after July 1st. So if you were in one of those narrow network plans, the Community Blue plan, you had limited or no access to several of the UPMC facilities. So if you'd been in that product for several years, you've gotten used to getting all your care at an Allegheny Health Network facility or independent facility.
Okay. Now I don't know if this is accurate, but I got a note from someone at some local employer that said they're working to gain access at this point for their employees to a broader network. Is that possible at this point? If they're in one, if they have a narrower network, can they expand that network at this point?
They will be able to do that. If the employer had signed up for the Community Blue Highmark plan, they will have the opportunity to move into the PPO plan, which is the broader network, which brings all of the UPMC facilities in play. However, we've had some groups that are in currently a PPO product, which means they have access everywhere. They're looking to narrow that down and actually go into the narrow network in a Community Blue plan. So we're gonna have shifts both ways. We're gonna have narrow network groups that want to go broad, and we're gonna have broad network or broad access into the narrow. So
the narrow network we usually think of is usually as a higher deductible plan. Is that correct?
No, let's think of the narrow
define
network.
those if you could a little bit for
Let's
us.
look at the narrow network as you're limited as to where you can get your care. So the narrow network, it really drives the member into St. Vincent, into an Allegheny Health Network facility, whether that be Allegheny General down in Pittsburgh,
Right.
St. Vincent up here in Erie. And so generally those narrow networks are lower cost to the member, lower cost to the employer. So you're going to be paying less out of your pocket every month, and we can work with deductibles on each plan. So it's how the group wants to set up their deductibles. But generally, the narrow network is going to be the lower cost plan as opposed to the PPO plan, which is open to everybody. That's going to be a little bit higher cost.
What's the breakdown, if I can ask, or can you give me some sense of the breakdown of how many people are in one plan, how many are in another?
Right now, it looks like there is about 30 to 35% of these groups that are in the narrow network.
Okay. All right. What kind of reaction are you hearing since Monday? Are you hearing, is this something that people are excited about? Are people pleased to see this, to see a resolution here?
Oh, I think Western Pennsylvania and all of the Erieites that I've spoken to this week are very excited about this. We here in Erie, we have 2 large hospitals plus an independent hospital in Mill Creek, and I've talked to a lot of people that utilize both hospitals, and so they might have a PCP in one hospital and a specialist in another hospital. So they're excited that they can still make that choice as to what hospital they want to go to, which physician they want to go to.
Okay. Are there other questions you're hearing from people?
We have one from a viewer. Maggie's asking about prescription plans, specifically elderly, and their prescription plans, possibly Medicaid connections to these changes.
There really is no changes to the prescription plans in terms of that. So I really don't have any insight on any changes that are going to happen for the Medicare plans.
And prescription plans, no changes?
No.
Okay.
So does this just become at this point like any other insurance contract between two healthcare providers, that it could be renewed past this 10-year point? Is this...
Absolutely. This is actually unprecedented on UPMC's side. UPMC, this is the longest contract that they have in place right now. Most of the contracts that they will sign with the health insurer runs up to 5 years. This one being 10 years is the longest that UPMC has committed to.
Is it the same with Highmark?
We haven't had any long-term contracts like this with a health system before, so it's a first on both sides.
Is there a reason to be optimistic in your mind going forward that this could just become the way it is?
I'm very optimistic right now, and the talks between David Holmberg from Highmark and Jeffrey Romoff from UPMC and the Attorney General, we are looking to, I don't want to say partner, but become good stewards of healthcare in the community. I see a commitment on both sides that we have this 10-year contract, that we're willing to work together and do what's right for the community. We want to bring healthcare to the community. We want to make the patient experience as positive as possible, and this is the first step in doing that by having this 10-year contract together.
And Jim, when we talk about the narrow network and the wider network, I think some people, and I got one email to this effect, can look at this and say, wow, it sounds like they're still warring, it sounds like they're still fighting, like there's still some divisiveness. But is this typical of what you would see in maybe in any other market in the United States, where one healthcare system would say, no, if you're in this narrower network, you'll save money. Mm-hmm. If you're in this broader network, is that really just a typical scenario? Can you talk
That is absolutely typical across this country. Is, like I said earlier, most health plans will have different plans that you can choose from. You can choose a more expensive plan, which gives you access to a wider variety of hospitals and services, or you can go with a narrow network plan. And our narrow network plan at Highmark, it's extremely high quality. Going into the Allegheny Health Network, you're getting high quality services for a lower price. And so in the Allegheny Health Network, we can control costs better, as opposed to having the member go out to different facilities where we really have no control over costs.
Okay. Any real concern that you're going to see? I know you said you've heard from people who plan to stay. Mm-hmm. Any concern that it's going to go the other way, that you're going to lose folks?
Actually, I think on the Highmark Inc. side, on the insurance side, we actually are looking to gain a lot of members. I know some of the national carriers came in last year, the Aetna, the United, and they signed up some members from the UPMC health plan and from Highmark, that these members were concerned that they weren't going to have access to both hospitals, to both systems. The Highmark product is a lower cost product than these nationals, and so we're actually looking to gain some of the members that we lost last year.
And I guess back to the issue of narrow network versus wider network, maybe this is something that people, many employers have a choice for their employees. am I correct, that they can elect which plan they want to choose. And I guess you would maybe counsel them if they want to have that choice. That's something they would look at next enrollment period.
Absolutely. I mean, this gives these groups, these members, the choice. You know, do they want to have access to, here in Erie, both UPMC Hammett and St. Vincent? If that's what they're looking for, then they have a product that will take care of that for them. If they're looking to save some money and have some lower copays, have some lower payments out of pocket every month, then they have that narrow network option.
And before, if they were only going to get one healthcare system anyhow, maybe it didn't seem like it was worth paying the higher price.
Correct. So this is best for the community. So we're excited about it.
And a follow-up question: any ideas on Highmark's marketing plan to get the message out about these changes that are ahead in the new contract that has been put in place, especially directed toward the elderly who maybe aren't that connected to social media and other more current forms of marketing?
Yeah, we plan on getting the word out to our members, whether it be through emails, social media, but also in mailings. So our seniors can expect to get mailings here in the near future. And if they did have any questions, we do have websites that they can go to. If they are on the computer, they have a smartphone, they can go to Highmarkanswers.com, and this can answer most of the questions that they may have. So there'll be some frequently asked questions on there. They can read through it. And if they do have any other questions, we can direct them to our transition team. And this is the team of people that are based here in Erie that help members transition from one hospital to the next. That number that they can be reached at is 844-576-1245. So if they had any questions about providers, if they had any questions about making changes, they could certainly call that number and get the answer they're looking for.
Bottom line, Jim, I think for months everyone was kind of conditioned for this is going to be the new reality. We're headed towards it. Get used to it. I know, Highmark, Allegheny Health Network, and UPMC were both kind of training people that, hey, here's how to get your new doctor. Here's what you need to do. We were a part of that as a news provider, and in many cases, there's a new reality out there. As we wrap up today, is there any message you'd want to leave people with? Is there any final word that you'd want to just share with people? That just a final thought you'd want to leave people with?
Well, looking at the last several years and seeing the investment that Highmark has made into the Erie community, into St. Vincent specifically, it's been $130 million up to this point, and that is with brand new facilities, a new cancer center that's going to be open soon, new emergency rooms, new operating rooms, the technology investment, the East Side Pavilion, the West Side Pavilion. All of these investments that Highmark has made at St. Vincent are going to continue. In fact, with this new contract, we can expect to see more investment in the Erie community and more investment at St. Vincent specifically. So all the wonderful buildings that you're seeing, if you've driven by the St. Vincent campus lately, that is going to continue and increase over the next several years.
Thanks to everyone who joined in and participated in this week's Go Erie Live discussion. The video will be available for replay on the Go Erie Facebook page and on the Go Erie homepage. Thanks again to Gannon University for sponsoring this discussion, and to Jim Teed for joining us today. You can find upcoming topics and guests on the Go Erie Facebook page each week. Thanks for listening.